My name is Russell Razzaque, as it is said, and I'm a psychiatrist. I work in East London, and I've basically been working in mental health for the last 20 or so years. And I guess what my book is about is a kind of sort of parallel of my own personal journey and my own sort of spiritual journey, but at the same time my kind of understanding of my profession and how things work and how kind of our minds work, really. And I guess that I started my training in a fairly conventional route, went to medical school and trained as a psychiatrist and learnt the way of understanding mental illness and different kinds of diagnoses and categories and treatments, etc. But then about 10 years ago I started to develop my own mindfulness practice, just entirely for my own kind of personal development. So I would go to retreats on a fairly regular basis and start to engage in sort of a regular practice after that. It took a bit of time, it took a few goes before I got to actually establish a regular practice. I would start daily meditation and then it would kind of, sort of wane off for a bit and then I'd start again. And I know almost everybody goes through that process. And as I got deeper and deeper into my practice, I started to notice some things that really started to strike me. So, for example, some of the practices that we were engaging in our retreats seemed to have some resonance with some of the things I was seeing in the people I was looking after in hospital. So, for example, we'd engage in things like mindful walking, so walking very slowly and deliberately, paying attention to every step. And then when I would come to work, I would see a lot of my patients doing the same thing on the wards, walking up and down, doing the same thing. Of course, they hadn't come to a retreat, they hadn't been seeking to engage in that kind of activity, but there was something very similar about what we were both doing. And then similarly, we would refrain from eating too much. We'd kind of have our last meal relatively early in the evening and eat relatively sparsely. And again, that would be something that I'd see a lot of people who are suffering depression or anorexia and other things doing as well. There would be a desire to try to we'd observe our thinking mind, so we'd observe the way in which our thinking mind is constantly whirring. And the descriptions that would come up about what's happening for me as I'm observing myself would sound very much like the way that we would describe people having anxiety reactions or mania or things like this. And it almost felt like what's happening for the people I'm looking after is also happening in a similar way inside me as I observe myself. And so these terminologies that we started to use to describe people in terms of their psychopathology, saying someone has a flight of ideas or is having a panic attack, it just felt like that's not dissimilar to what's going on in all of us. If we look deeply enough inside and see what's going on, there's a very mirroring process going on between what's happening inside and what's happening out there. And so over time, as my practice deepened over the years, I also started to have experiences that I subsequently learned most people do after they've been meditating for a number of years, in terms of just almost a sense of your sense of self dissolving, and it's very hard to put into words, but kind of just feeling a connection with things beyond your own kind of encapsulated ego boundaries. And I learnt meditation through Vipassana retreats, and they didn't talk very much there about what these phenomena were. So I found Zen masters and other teachers who were able to then describe how this is a part of the process. This is supposed to happen. And incidentally, at the moment, as you know, mindfulness is quite big in the mental health world. What concerns me a little bit, though, is that people are describing these experiences as pathological, that these are the side effects of mindfulness meditation. But actually, this is the purpose of mindfulness meditation, for you to start to experience some dissolution of your ego. And then you start to experience this kind of connection at these times, and sometimes in between too. And that then started to enable me to look on what people were coming to me with in completely different eyes. So somebody talking about the grass talking to them, or the sky talking to them, or their neighbours, or the person across the street talking to them, you can suddenly understand that actually I can feel inwardly something about that. That there's something authentic in there that they don't have to lose. It's not all about causing illness. Some of it, of course, a lot of it is, of course, very painful. A lot of it can be deep suffering. But at the same time, there seems to be something else they're touching that looks a bit like what I've been experiencing through my own spiritual practice. So it began to really occur to me that there's a different way of seeing these things, that perhaps there's something positive about breaking down. It's a bit like in the same way that when you injure your skin and your skin inflames and things kind of inflame a bit, at the same time there's also cracks that develop in your skin, and so something can come through it from the outside. And it's similar, I think, with our egos, in that as it gets injured through life, as we experience traumas and stress, the ego can inflame to lead us to experience all sorts of suffering. But at the same time, when that happens, simultaneously cracks start appearing in our ego structures, and so as a result of that, whatever it is beyond the ego, whatever it is outside our ego framework of understanding the world, starts to come in. Which is why, for example, something like 74% of people who've experienced what's defined as a severe mental illness will say that spirituality is very important to them. And that's something like 10 times more than the general public. So there's something going on here in terms of their experience. There was another large study that found that there was a higher incidence of people with mental health difficulties amongst those who described themselves as spiritual but not religious. But again, for me, it was almost like that came after the breakdown. There's something about having these experiences that leads you to connect to something. It's a kind of, and it's been written about in spiritual literature for thousands of years. The dark night of the soul, and even if you look at some of the prophets described throughout time, they've all seemed to have gone through a period of deep suffering before they've realized their enlightenment. So there seemed to be something that we're missing here, that in terms of our treatment of people who are experiencing these things, it shouldn't be just about saying, this is all bad, we need to get rid of that and get you back to where you were before. It should be about saying, yes, perhaps we need to do some things to help you curb the worst excesses of your suffering, but there's somewhere that this experience is taking you. There's something else that you are growing into through this, and perhaps we can help you with that too. So having an openness, and that doesn't mean us coming to people who are having these experiences with a perspective in terms of this is where you should be going, this is what your enlightenment will look like. It'll be different for everybody, but it's creating that space where they can find the meaning of their suffering inside there. And I think that being able to do that would transform the nature of the work that we do as mental health care professionals, but it would also change society as well, because I think we do need a different attitude to the suffering we have, because it is ubiquitous in the way that we run ourselves as a society today. You don't have to spend 5 minutes looking at the TV before you start to feel the pain of what's happening outside. All the conflicts going on in different countries, the vast kind of epic scale of inequality that we're seeing everywhere, and the kind of negative energy that we feel as a result of disenfranchisement from the political process. You don't have to step too far before you feel yourself teetering on the edge of the precipice. And we see it everywhere we go. Now, the thing is that I think that there could be some meaning in this suffering. The sadness that we feel when we experience these things is also taking us somewhere, if we don't resist it. If, of course, the most difficult parts of it are things that we might need help with, but at the same time, if we also see that this suffering is taking us somewhere. So I'll give you an example just from the last few days. In my own organisation where I work, several people have had some very strong bad news recently. One of our directors has lost a father, another one lost a son, there's another person who resigned. It is a bit of a mirror of the fact, or a microcosm of the fact, that wherever we go we're going to suffer. We are going to find suffering wherever we go. And so to recalibrate our relationship with suffering, not something to push away or to deny or to try to remove and get rid of, but actually something that contains some real healing for us as well, somewhere that we need to go. One of my meditation teachers once talked about an anecdote where he basically worked in a leper colony in India for a while. And what he discovered is the reason most people were there and most people were suffering is because they had no reaction to pain. And because they had no reaction to pain, they would get infections, they would get injuries, they wouldn't be looked at, they wouldn't be treated, and in the end their limbs would end up coming off as a result. And he said the lesson that he learned from this, and this is just before he went to stay in a Buddhist monastery for a couple of decades, the lesson that he learned from this is that pain equals attention here. So when we experience pain, what that really is doing is calling us to it, to pay attention to it. And of course our reflex is to do the opposite. We might binge on food, or we might try and take a pill, or we might try and do something to remove it. And that's natural too, I can understand that, I do it myself. But wherever possible, trying to find the message in the pain, trying to go towards it because it's calling us to learn something about ourselves and about our nature, our true nature. And I also believe that what that nature is isn't something that any of us can put on a book and say this is the truth. It will be different for everybody from whichever way they come. But by enabling everybody to have their journey and find their reality through their pain, we can then all learn from each other. So my pain will take me to one kind of understanding, and I'm still exploring what that understanding is. And your pain will take you to another understanding. But if we respect each other's positions, then we as a society can start learning from each other and moving to a different place, I think, moving to a different consciousness in which we respect everybody's individual wisdom, but knowing that there is no one truth that we're going to follow, but allowing everybody to have their truth. And practically how to do something about this. I came to this realization over a period of years. I then wrote the book, which I released, and since releasing the book, I have to say, it's been just a wonderful experience. I've had people from Australia, Canada, America, writing to me all over the world, really, and saying how much this resonated with them, how much what I discussed in terms of the way of there being something positive in this breakdown, awful as there has been, and something revealing to them about this process. These things were something that they've always known, that they've had these experiences and they've known this was the case, but they're so grateful to have learnt that from somebody who works in the profession, and know that this isn't just something that they thought. There's actually a wider acceptance of this. And so I was really struck by that. I was also struck by a piece of research that came by a lovely guy, Charlie Harriet Maitland, who's a psychology researcher at King's College in London. And what he did is he looked at two populations of people. One population who had what are called sort of out of the ordinary experiences and ended up in hospitals and receiving antipsychotic medication and staying in the system often for decades, and usually for decades. Usually once you're in, it's hard to get out. And those people who never got into the system but had similar experiences, and there wasn't much difference between the two sets of experiences, but never went to the system, they never went to see a doctor, they never got any pills, and they got on with their lives, and somehow they managed to integrate themselves. And he looked at the difference. What is the difference between these two groups? And the biggest difference that he found was that in the second group, there was a community of validation around them. There were people in their community, in their network, who would listen and who would respect what their experience was and not immediately label it and say, this is mad, this is illness, there's something wrong with this. Actually, they had that respect, they had that validation. So acceptance and validation seem to be the most healing thing. And that goes with the philosophy of us all learning from each other, that I might not get what you're saying, it might not make sense to me, but there's something valid, that if you believe there's something valid in this, then perhaps there is. And the bottom line should really be about not whether or not it's real or not. It shouldn't be. I don't think psychiatrists, and I think we will come to a day when psychiatrists stop being the reality police. It shouldn't be about whether or not something's real, but it should be about whether or not something serves a compassionate purpose, And there's many ways to look upon things, and as long as it's not harming yourself or anybody else, then fine, So, in order to try to practically do something about this, I set about, because I'm a psychiatrist. I'm also now one of the in management in my organisation as well. So I've managed to get together a bit of a coalition with a group of organisations to try to change the way we do mental health work. And it's based on something called open dialogue, which was started initially in Finland. So in Finland, they used to have some of the worst psychiatric services in the world. And because it was so bad, the government allowed them to do a series of experiments to form some completely new services there and try something completely different. And one of the services, called Open Dialogue, just shot off away from anything else. 74% of people who had an acute episode of psychosis were back to work or study within 2 years and out of the system. And that's 10 times higher than we get. That's way beyond what we get. And what they do is they never see a person on their own. They see them with the whole community together. They invite anybody who's interested, any friend, any family member, any other agency involved. Everybody sit together and find meaning in what's going on, and not necessarily be told that, okay, this is what you've got, this is what we're going to do for you, this is how we're going to fix it. It's more about how we all work together to form a relationship and build over time something based on what's happening. And everybody's learning from each other there. And so the hierarchy is very much changed. And so what I managed to do, because there had been knowledge about open dialogue for many years in the system, actually it's gone to a number of countries. New York spent a few $1 million on setting up an open dialogue service. So it's begun to go in different countries. So I got a coalition of 4 different trusts in London and in Essex and in Kent and in Nottingham to launch pilot open dialogue services, and we're going through the training at the moment. We're learning from people from all over the world who are training us to operate this way, and the idea is that at the end of the year we'll launch the services, and then we'll try our best to run them as purely as possible without the kind of way we do things at the moment, and compare our outcomes to treatment as usual over the next 4 or 5 years, and hopefully demonstrate the big difference between the two. That actually, if we can get people away from mental health services sooner, then it serves everybody's purpose. It serves the government's purpose too, because we don't, it's not such a drain on taxpayers' money either. So it works on a number of levels, which is why I've managed to convince all the way up to the Department of Health to be interested in supporting the project. What we do lack, of course, is funds, so we're grappling with frontline funds from the NHS to try to get these pilot services to work, and we do need more support where that's concerned. But we're trying our best, and we have about 50 or 60 clinicians now, 10 or 15 psychiatrists, and the rest are nurses and psychologists and others who are working on setting up these services. And the most important thing we're teaching people is to become an expert in not being an expert, to unlearn what we've learnt and realise that we can learn as much and grow as much ourselves through a process as anybody else. And the wonderful thing is that spontaneously through this training people have come to the realization that there's no them and us. There's no people who have broken minds and people who are well. All of us have our wounds, and actually we can all benefit by sharing a process rather than pretending to be the ones who are the fixer, the healer and the wounded kind of thing. It's more of a relationship of equals. So that's the kind of practical manifestation of a lot of things that I've thought and learnt over the years. I'm hoping that over the next sort of few years we'll start to change the way. I also feel like there's a shift in energy going on here. Maybe the Mayans were right about 2012. There's something different. I don't think these conversations would have been possible a few years ago. But something is shifting. We're having a conference in central London on the 11th of March, and we have already 600 people booked to come. So there's a lot of interest and enthusiasm for changing into a new direction, and I think that if we can change the way we deliver our mental health care, it can have quite a fundamental ripple effect on the rest of society as a whole, because we can start to all listen to each other rather than think that this is normal and this is not normal. Well, the reality is that in terms of a physical illness type of illness, anybody who puts it in those terms and says that a mental illness is just like a physical illness, you just have to ask one question. What is the physical test to know that someone is mentally ill? And there isn't one. There never has been one. So if you have appendicitis, for example, I could take a blood test and see that you've got a raised white cell count, right? And there's many ways, and if you have pneumonia, I could take an x-ray and see that you've got, some gunk in your lungs. And you could do that with pretty much any physical illness. With mental illness, there is no test. There is no way of discerning that somebody has this physical change going on. And there is a huge amount of debate as to whether or not there are actual things that are happening. Okay, there are different schools of thought around this, but there's no clear-cut answer. I went to a lecture a few months ago by the head of neuroscience at UCL, and he said we have to admit that in all our years of research we have never found any physical, actual underlying change, underlying specific causative element in mental illness. There are theories about dopamine and different hormones changing, but they are theories. Now, the theories came about from the fact that some drugs were having some effect. Okay, and so the theories were reverse engineered from those drugs' effect being known. Okay, but it hasn't been very specifically found then when they've looked into people's brains afterwards. So there's lots of debate about this. Okay, and I guess the way I see it, that sometimes an illness construct or a construct that's a bit more biological can help people. Some people find some comfort in understanding that way. That's fine, and then it can work. Okay, but other people reject it. Other people vehemently reject it and find that it doesn't help them. And so I think that working with people in a way that enables them to lead on how they understand their experience is very important, because we have to admit with some humility that we don't have the kind of technological certainty that other branches of medicine have. And because we don't have that certainty, then we can be in an uncertain place and allow others to do the leading. And it is about the person having the experience. So it's about how they see it. Some people are vehemently anti-diagnosis and anti-illness definitions as well. Okay. But again, there are many people who have these experiences who really see that as important, and so therefore, who am I to say no, that doesn't exist? So this is a grey area, and I think it's important for us to treat it as such. That's basically what I'm saying. Okay, there was a study, a very big study that the World Health Organization, the WHO, did over a decade, or more than a decade, and they looked at outcomes for psychosis in people in developing countries, and they compared them to people in the developed West, where we have hospitals and medication and things. And what they found is that the long-term relapse rate was lower in developing countries than it is in the West. Now this is something that we're taught in medical school, and it's kind of brushed under the carpet because it's quite embarrassing. But if you go to those countries and you look at what they're doing these kind of things, okay? So they will have, whether it's imams or spirit healers or other things, going to them and working with them that way. And if it works, it works, you know? So I'm for anything that works, for whatever person, and it will be that person and their belief system that helps them define that. I used to work in a secure ward where people who had been violent were then admitted, and I worked in those kind of wards for years. We would put people on antipsychotic medication. Sometimes it would work in 2 weeks, 4 weeks, sometimes it wouldn't work for 2 months, 4 months, 5 months, 6 months. There was no consistency about how people responded. And even the most kind of biological of my colleagues would admit that. Now, I don't really know when they're going to get better. And sometimes I'd ask the patient, well, I'd always ask the patient, what do you think got you better? And half of them at least said, oh, it's the spirits, they've gone now. And I would think, well, who am I to say that's wrong? You know, what do I really know? So to know that we don't know is the most important thing, I think, in terms of a position for the clinician. But yeah, for people's experience, if that makes sense to them, if that works for them, if that's how they're going to improve, then absolutely. You know? I worked in addictions for a few years myself, and I guess it's very strongly interlaced with all of this, because most people who are into some kind of addiction are trying to heal some emotional pain as a result. So underneath the addiction is often some emotional pain, and often when we would treat people of their addiction, they would start to experience depression, or some then psychological issues would come up. So the two things are very closely interlinked, and I guess that sometimes drug use is also a way of trying to shortcut that process. So I've created it in the book. I've created a little bit of I call it a wheel of awakening. So if you imagine a wheel, and you imagine that there are two forces taking in opposite directions. There's one force which is kind of self-work, like mindfulness, yoga, and all sorts of other spiritual activities that take you on an anti-clockwise direction up the wheel, okay? And at the top of the wheel, 12 o'clock, is kind of awakening type of experiences, beginning to come out of your ego shell. So going in an anti-clockwise direction is doing some self-work in which you're one brick at a time, slowly dismantling the ego, gradually and deliberately and slowly. Going in a clockwise direction is stress, trauma, and drugs, which can also take you to that place, but in a pretty chaotic and sometimes violent way. But it's also taking you in that direction. So they're similar things, and that's why people will often take drugs, because it takes them out of the pain they're in, and it will kind of lead to glimpses. I mean, there's plenty of literature about people using some of these substances and it leading them to glimpses that are not dissimilar to then experiences that people are having through meditation and other spiritual practices. In fact, there was a really great anecdote by Ram Dass, who went to his teacher in India and mentioned to him about LSD, and his teacher said, well, can you bring some for me? And so he, after much soul searching, he did, and he gave him a couple of tablets and he didn't notice anything. And he said, well, go back and get me some more. So he gave him a handful of tablets and he took them all, and he still didn't notice anything. And basically he was in that place where people go to by taking these tablets anyway. So essentially what he was, and what his teacher said to him, is that we've known about this stuff for generations here. What it is that it's like picking up the phone, and then as soon as you get a connection you put it back down again, because these are like quick shortcuts to those kind of places. So that's why I think people who are having some kind of breakdown will often resort to these kind of things. So the two things are very interlaced, and it can take you to those places, but not in a long-term way, So I can kind of see how, that also fits in with the wider picture. So yeah, and I do talk about that in the book, and that is part of the suffering that people experience, and it's part of the way that people try to make something of the experience. And it doesn't come from an altogether wrong place. It's an understanding that there's something here that I can chase. But there are other ways of chasing it that can be long-standing and more foundational and deep. Well, I guess that, for me, really, the big, as I sort of started to write the book, and I was opening myself up to lots of different ideas, open dialogue has become the big one, really, for me, because of the way in which it's a system transformation. And the problem is that, there are other therapies, for example, acceptance and commitment therapy, which I really love, which is very clever guys in the States, experimental psychologists, have essentially used a lot of the language, and they won't really admit this, but they use a lot of the language of Buddhism. They've converted it into scientific kind of experimental psychological language that you can then use for patients and help them. So it's a very kind of acceptance and mindful-based way of helping people, and that's great. The only thing is that if people are having that, but they're within this psychiatric system that doesn't recognise their experience, in a more holistic sense, then in the end they end up getting pushed in two directions, So the reason I like open dialogue in particular is because it's a whole system change. It's about everybody coming together to work in a different way. And so I think that's very important. But when that happens, it then opens other possibilities for anything, any other kind of possibility to be used for the person, depending on where they're coming from. And the other, for me, the biggest thing for me has been mindfulness. And I teach people that. I run retreats for clinicians mainly in mindfulness to help them to know their own stuff, so it doesn't project onto other people. Which is happening all the time. We don't get much emotional education in mental health care, so it's helping people with that emotional education. So mindfulness, for me, I think has been very powerful, but I know that not everyone can take that road, but I advocate it, and I do also teach people to teach it to others as well, to people they're caring for. And it is, for me, I guess the best sort of teaching around that is to try to maintain some consistency. If it's only a couple of minutes a day, that's good enough to start off with, then you can build it up slowly. So I used to do standing up with my eyes open for about 5 minutes a day, and gradually built it down to closing my eyes, sitting down longer and longer periods of time. So, and then it'll still come and go, just like your focus on the breath. Your ability to sustain the practice will come and go, but you can restart. So for me, that's probably the most powerful, because you're connecting with the function that is able to observe what's happening in your mind, and you're realizing more and more that your thoughts are not who you really are. So that's for me the most powerful one. Breakdowns while they're going through these spiritual practices too. So it needs to be kind of done in your own pace, and there shouldn't be any sense. That's why when I was talking about mindfulness, it's very much if it works for you, So it should be very much a voluntary thing, and something that people can feel is right for them. You have to find the space for it from within, and not feel like I'm missing out if I don't go to a retreat or something like that. So I think it's important. On the other hand, I don't think it's right for people to be excluded from these things just because they've had breakdowns in the past. So I think that there is some of these things that can happen. I, for example, ran a mindfulness group in my acute secure ward where I used to work. So there are people who'd had quite severe breakdowns and been violent as a result. But I used to run it every day for 15 minutes every day for anybody who wanted to turn up, and it was for patients or staff or anybody. And the staff didn't come, but the patients did. And not all of them, of course. And when they were in a really bad state, they wouldn't come, but when they weren't, then they would. And people would come and go. And similarly, actually, with open dialogue meetings, people could, the person suffering can come and go. They can walk in and out however long they want to stay. And so I think as long as these things are couched in very, very elective ways, that you take what works for you. Yoga can be very good. Very light yoga, at an early stage can be good. I think that's important. I think it's very important that no one feels pressured to engage in a spiritual journey. It is what is right for you at that time. When I've been meditating, so I started meditating, and then I got into a regular practice, I guess things come up for me all the time. So there is pain that comes up all the time on a regular basis, and I wouldn't be able to do the things that I do if it wasn't for my regular meditation practice, because it's a way of me being able to observe all this pain. And in the first couple of years, there would be things going back to my childhood. So after meditating regularly, there would be things that would just sort of appear from my childhood. And then even things before that in terms of my parents' experiences. My parents come from Bangladesh, and they lived in a country where, that there isn't that much security. You could, your job could disappear one day, and then the next day you could be destitute in the street, and the next day you could be dead. And these things can happen, and they knew people around them who this happened to. So therefore, there's a fear that's built into them in life, and so they're very protective and they're very cautious. They don't like me to be out at this time of night, even at this age, So there's example, and I can feel, and through my own mindfulness practice, I have connected with that fear, I've touched that pain, and that's inside me. It's a part of who I am. But I can observe those things going way back. There was a time when I was meditating, and I was hearing the voice of my mother crying, and it felt very deep. It didn't feel like her normal voice. It felt like a really deep voice. And I just had this sense that it almost feels like I'm hearing it from inside a vessel, like maybe I was in the womb. So I asked her that when she was carrying me, was there a time when she was depressed or feeling sad? And she told me about, actually she came to this country just before she got pregnant with me. And my dad was working at the time as a junior doctor, and he was all over the place, and so my mum was alone at home, so she had a cat, and she really loved that cat. And then just as she became pregnant with me, the cat disappeared. And so she was mourning for the cat in a big way, so much so that one of my dad's friends, who I think was I can't remember, a psychologist or something, said, you probably need to find this cat, because this can have effects on your unborn child, the amount of grief that your wife is going through. So they went street to street and found the cat, and brought her back. And And I think that, and there was a possibility that that might have had some effect on me, and I think that it did, and I think that I actually noticed it, because I came back 30 years later to ask her, was there something that happened when you were carrying it? Well, actually, funny you should ask, but there was, now I think about it. So we can contact all sorts of things through these processes, and they're sitting in all of us. One of my favourite authors around these things is Pemba Chodron. She kind of helped me while I was meditating by reading her book, and I've given this book out to people I've looked after before, and Wisdom of No Escape, I think, is my favourite one, and there's others like that, The Places That Scare You. And she talks about how all of the messiness and the stickiness and the craziness and all of these parts of us make us who we are. We can't be anything unless we're all these things too. And so the challenge is not to try and remove these parts of us, but the challenge is to find a way to be present with them and to allow them to be as they are. And then we stop being dominated by the need to remove them. It's actually the need to remove them that makes them control us then. So yeah, I have been and I continue to exist in the journey where I'm looking at all of the suffering that's going on within me, and it does mirror what's happening outside, because you're affected by what's happening outside too.